STD stands for sexually transmitted diseases. Hi, I'm Tammy, and today I'm going to give you the lowdown on STDs. Now, I know some of you guys are probably saying, whoa, that's a little bit too weird or maybe too embarrassing. But for some of you, it may be hitting a little close to home. So now do you know what I mean when I say STDs?
Clap. Chlamydia, gonorrhea.
That stuff, they call it that stuff. Or she got you. Flamethrower, that means chlamydia, she got chlamydia.
You got it. The clap, the drip, the pox, Mary Jane, the jack, crabs, AIDS, and a bunch of other bad stuff you probably never thought would touch you or your world. But see, that's why I'm here. So you need to know that these diseases are real and they are all around you. So if you're not careful, you could end up in a mess you never dreamed of. Did you know that every year, actually every day, sexually transmitted diseases affect millions of people just like you and I? I know some of you guys are probably thinking, okay, well, I don't feel any problems going on with me, and I don't think I have anything to worry about, or maybe this girl is just talking crazy. Maybe you're thinking that, but the odds are, if one of you watching this video does not have an STD, you know someone who does, and you just don't know about it. See, 1 in every 7 people in America over the age of 15 has a sexually transmitted disease. So my question to you is, how many people do you know? Well, according to the American Social Health Association, 15 million Americans contract a sexually transmitted disease each year. I know, scary, right? 15 million people, that's larger than the entire state of Ohio. And 2/3 of these new cases are people younger than 25. And 1 of 4 of these cases are teenagers. So if so many people in our country are suffering from these diseases, why is it so many people are unaware of it? Well, if you can imagine, people with STDs aren't racing around to tell people they have one. Today, I'm going to give you the basics on sexually transmitted diseases so that you don't have to become the victim of one. If you or someone you know thinks you may have an STD, I'm going to tell you what to look for and how to get help. Unprotected sex with infected partners is how it happens. And it's not just intercourse that causes these STDs. There are some diseases that can be passed by having oral sex, while other infections, such as genital warts and herpes, can be spread through skin-to-skin contact. There are 3 main categories of STDs.
First, we have parasitic infections, which are caused by, you guessed it, parasites. Examples would be crabs, lice, and scabies. These are considered the least serious of the 3 types of STDs and can be treated and cured. Second are bacterial STDs, such as chlamydia, gonorrhea, and syphilis. These are diseases caused by bacteria that can be treated and cured if you catch them at early stages. Bacterial infections can be considerably more damaging than parasitic infections. If left untreated, bacterial infections can lead to severe sickness, pain, and even cancer. The third type of STDs are viral infections. These are bad because they're treatable, but not curable. If left undetected, they can kill you. The primary viral infections are genital warts, herpes, hepatitis, and of course HIV and AIDS.
Syphilis, chlamydia, HPV, and gonorrhea. Everybody loves their STDs. They are what people get from unprotected sex. Everybody loves their STDs. You might think that everything is wonderful, but you don't know where they've been before. If you don't protect while your things erect, wait and see just what you have in store. Chancres, itching, and herpes, AIDS and hepatitis B. Everybody loves their STDs. People try, but they don't know that sometimes symptoms don't show. Say hello to all your STDs. Now this is the second verse of the song. It's the most important verse of the song. It's the difference between life and death, good and evil, discharge and no discharge. Because STDs are not just transmitted through sexual intercourse. There are other ways. So if you want to know the truth, listen up. You may think you're showing me you love me when you go to get down on your knees. But if you want to show me how much you love me, open some latex used for oral sex and put it inside your mouth, please. Syphilis, chlamydia, HPV, and gonorrhea. Everybody loves their STDs. They are what people get from unprotected sex. Everybody loves their STDs. If you want to show me how much you love me, come down to the health center with me. If you want to show me how much you love me, there's no need to stress, we'll get that test. Awareness is so sexy. Syphilis, chlamydia, HPV, and gonorrhea. Everybody loves their STDs. They are what people get from unprotected sex. Everybody loves their STDs. Please don't give them to me.
Hi everybody, this is Kaylee, and today we're going to be talking about one of the worst possible downfalls of having unprotected sex, sexually transmitted disease, chlamydia. Chlamydia is a sexually transmitted disease caused by the bacterium strain called Chlamydia trichomus. And unfortunately, this particular STD, when left untreated, can lead to serious, long, and short-term negative effects on reproductive health. So today, we're going to find out A, how common is chlamydia and what are its symptoms? B, well, if you are infected, then what? What kind of treatment is available? And lastly, if left untreated, what kind of complications can arise from being infected with chlamydia? As with any sexually transmitted disease, if you are sexually active, you're at risk for contracting chlamydia. According to the CDC, however, chlamydia is the most highly reported STD in the country right now. Actually, according to a recent survey, there are over 2.2 million U.S. citizens between ages 14 and 39 that are currently infected, most of whom don't even know this. That's because 50% of women and 75% of men who have chlamydia don't have any symptoms whatsoever and are unaware that they're infected. Now, for those who do have symptoms, usually appearing 1 to 3 weeks after infection, this is the not so fun part because they can include any of the following: discharge from the genitals or pain while urinating, general bleeding and pain, and for some women, fever, nausea, and pain during sex. Chlamydia itself can be contracted through oral, anal, or vaginal sex and can manifest itself in the vagina, penis, throat, and anus. No bueno. So, if you are infected, well, then what? What kind of treatment is available? Being a bacterial disease as opposed to a viral disease, chlamydia is fairly easy to cure and treat once diagnosed. The CDC suggests that all women under 25 should go for regular yearly testing, all women over 25 with new sex partners should be tested, and all pregnant women should be tested for chlamydia in an effort to diagnose, treat, and prevent adverse effects from arising. So, once diagnosed, chlamydia can be treated with a single dosage of the antibiotic called doxycycline, and this usually lasts about a week. And during this time, most doctors suggest that all infected persons and their partners abstain from all forms of sexual activity. So, if left untreated, what kind of adverse complications can arise from exposure to chlamydia? Generally, treatment is fairly easy, and chlamydia can be cured. However, due to the fact that most men and women with chlamydia are completely unaware that they are infected. Many adverse effects and complications can arise before knowledge of the infection is even, there. And generally, for women, these effects are more serious. Men rarely, if ever, have complications from exposure to chlamydia. However, in some rare instances, the infection can spread to the epididymis, which is the tube from the testes that carries sperm, causing general pain and, in some rare cases, sterility among men. For women, however, a range of complications can occur, since chlamydia can spread from the cervix to the uterus or fallopian tubes. In 40% of untreated cases among women, these patients contract PID, or pelvic inflammatory disease. PID can lead to permanent damage of the reproductive organs, which in turn causes things like chronic pain, infertility, or pregnancy outside of the uterus, called ectopic pregnancy, which can be fatal. Also, in pregnant women with chlamydia, the disease can be passed from mother to child during a vaginal birth. Now, for a newborn baby, this can cause a myriad of complications, including things like pneumonia and pink eye. In very rare instances, arthritis, skin lesions, swelling of the eyes, or urethra can also be caused from exposure to chlamydia. For all you gentlemen out there, I want you to stay with me for a second and imagine you're Johnson and this book. Now, that wouldn't be too comfortable. Join me for a future video where we're going to discuss the clap, more commonly known as gonorrhea. Did you know that 75% of Americans carry the herpes virus? Join me in a future video where we'll discuss this and more facts about herpes. Well, folks, if that's not enough incentive to wrap it before you tap it, use a condom, then I don't know what is. This is Kaylee. Thanks for joining me on our discussion about
HPV and gonorrhea. Everybody loves their STDs. They are what people get from unprotected sex. Everybody loves their STDs.
Hi everybody, this is Kaylee. Today we're going to continue our discussion on STDs by talking about the clap, more commonly known as gonorrhea. Well, what is gonorrhea? Are you at risk? And we'll also discuss how gonorrhea can affect pregnant women and their babies. So, what is gonorrhea? Gonorrhea is a bacterial STD caused by the strain of bacterium called Neisseria gonorrhea, which likes to thrive in warm, moist places. Gonorrhea can appear in the reproductive organs, the mouth, throat, and eyes. It's a very common infectious disease, and in fact, 700,000 new cases of gonorrhea are reported each year to the CDC. And in actuality, this is only half of all cases. Contracting gonorrhea is actually fairly simple. No fluid exchange has to occur, and all that has to happen is exposure to the infected site. So, are you at risk for contracting gonorrhea? Well, if you're sexually active and unaware of your status, then yeah, you're at risk. Most men and women who have gonorrhea show mild to no symptoms whatsoever. Now, for men who are infected with gonorrhea and do show symptoms, they'll usually appear 2 to 5 days after being infected, but they can take up to a month to show up. And if you are infected with symptoms, they can include the following: burning sensation while urinating, a white, yellow, or green discharge from the genitals, or swollen and painful testicles. Ouch. Now, with women who have contracted gonorrhea and show symptoms, they're often very, very mild. Most doctors can even mistake them for a simple bladder or vaginal infection. The symptoms that occur from gonorrhea can include pain in the genital area, increased vaginal discharge, or bleeding between periods. Now, for both men and women, the disease can also appear in the rectum or the throat. Symptoms in the throat are often mild and can be mistaken for things such as strep throat, but when it comes to an anal infection caused by gonorrhea, things such as painful bowel movements, bleeding, or discharge from the anus can also occur, and this is in both men and women. Now, With or without symptoms, if gonorrhea goes untreated, long-lasting severe damage can happen. As we discussed with chlamydia, gonorrhea can also cause pelvic inflammatory disease in women, which can cause things like long-lasting chronic pain, an infection of the fallopian tubes, which can lead to infertility, or internal abscesses of the reproductive organs, which is like a pus-filled pocket inside of your uterus. And for men, the disease can also lead to infection of the epididymis, which are the ducts attached to the testes, causing painful swelling of the testes, and in some cases, sterility. In rare instances, in both men and women, gonorrhea can spread to the blood and joints, and this can be life-threatening. Several laboratory tests can be done to diagnose gonorrhea. However, the most common is called a Gram stain. A Gram stain is done in the physician's office when a doctor will take a sample of the urethra of a man or the cervix of a woman and examine that sample under a microscope to search for gonorrhea bacteria. However, this test generally works better for men than it does for women. After diagnosis, gonorrhea can be treated using several different antibiotics. However, across the world and in the United States, several drug-resistant strains of gonorrhea are popping up, more and more over the past few years, which makes successful curing and treatment of this disease very difficult. Now that we've discussed if you're at risk and what can happen if you are, let's talk about what can happen with pregnant women exposed to gonorrhea and their children. Basically, if a pregnant woman has an untreated case of gonorrhea, she can pass this to her child during vaginal birth. Now, this can cause extreme complications for newborns, including blood infections, which are life-threatening, joint infections, and sometimes blindness. Doctors and the CDC suggest that if gonorrhea is found in a pregnant woman, it needs to be treated immediately to try and avoid these complications. Hi everybody, this is Kaylee, and today we're going to continue our discussion on sexually transmitted disease by talking about genital herpes. So, first and foremost, what is genital herpes and how common is it really? Well, genital herpes is a viral sexually transmitted disease that takes two forms, type 1 HSV1 and type 2 HSV2. Now, the more common one is HSV2 in most genital herpes cases. Right now, in the United States, 45 million people have reported to the CDC that they have genital herpes. That means 1 out of every 5 adolescents and adults have the disease, which also means it's Russian roulette down at the frat house. Genital herpes type 2, HSV2, remember, is more common in women than it is in men. Typically, 1 out of every 4 women with herpes has type 2, as opposed to 1 out of every 8 men. Overall, however, over the past decade, numbers of genital herpes cases have been decreasing in the United States. So, if 75% of the adult population actually carries the herpes virus, well, how do you know? How do you have any idea if you're infected with genital herpes? The signs and symptoms may or may not occur. Most people with type 2 genital herpes have no idea that they're infected. However, if symptoms are going to occur, they'll usually show up about 2 weeks after the virus has been transmitted. And they'll show up as painful blisters around the genitals or rectum. Unfortunately, these blisters will burst, leaving tender ulcers that take anywhere from 2 weeks to a month to heal. The first appearance of these sores in people with genital herpes is generally referred to as the first outbreak. Now, when this happens, some other things can also occur, such as a secondary cluster of sores appearing immediately after the first has healed, and also flu-like symptoms, including fever and swollen glands. Now, unfortunately, most people with type 2 genital herpes have no idea because they never have sores that show up. And if they do, it's so mild, it's often mistaken for another skin condition such as a rash caused by your genes or sometimes even a bug bite. Now, Typically, if this first episode or outbreak has occurred and been diagnosed properly, those with type 2 genital herpes can expect to have 4 to 5 more outbreaks over the course of the first year. Typically, these will decrease with time. However, if you have type 2 genital herpes and are unaware, years can go by without the occurrence of a first outbreak. So, if you have herpes, whether or not you're aware of the signs and symptoms, or if you show them, they can cause complications. Now, in adults who have suppressed immune systems to begin with, infection can be severe, causing painful genital sores in most adults and adolescents. We've already discussed this. However, for the most part, herpes causes more psychological distress than actual physiological distress in the infected. This has one exception though. With pregnant women who have been diagnosed with herpes, they can pass this on to their newborn children during vaginal birth, and this can lead to serious life-threatening infections in their babies. Now, for the most part, if herpes has been previously diagnosed, a cesarean section will be performed to deliver the baby so that these complications can be avoided. Now that we've talked about your risk of getting genital herpes and what can happen once becoming infected, let's find out. Is there any treatment for herpes? Well, yes, there is treatment for genital herpes. There are certain antiviral medications out there that can help prevent or shorten outbreaks in some cases. However, being a viral sexually transmitted disease, at this time there is currently no cure for genital herpes. So, once you have it, you're stuck with
Unprotected sex, everybody loves their STD.
1,000 cases of syphilis are reported in the United States annually, 2/3 of them amongst homosexual men.
Syphilis is a sexually transmitted disease caused by a bacteria known as Treponema pallidum. Syphilis is curable, but if allowed to progress without treatment, it can result in serious illness or death. Syphilis has been around for centuries and has infected some of history's most famous individuals. 18th century composer Franz Schubert, England's King Henry VIII, and 1920s gangster Al Capone all had deadly cases of syphilis. Today, the bacterium spreads the same way it always has, through direct contact with a syphilis sore, which are usually located on the genitals. For this reason, syphilis is usually passed sexually, although a pregnant woman infected with syphilis may also pass it to her baby. If a person contracts syphilis, it can go through 4 stages, particularly if left untreated. The first, or primary stage, is marked by the appearance of a painless sore or chancre, about 20 days after infection. Within a week or two, the chancre usually heals on its own, but because a syphilis lesion increases the risk that a person can contract HIV by 5 times, abstaining from sex at this point is vital. After the chancre heals, the secondary stage of syphilis begins. A painless red or brown rash may appear on the body, especially on the palms of the hands and bottoms of the feet. The secondary stage is also characterized by flu-like symptoms, including fever, fatigue, and aching muscles. Because these symptoms are often indistinguishable from other diseases, syphilis is known as the great imitator. These imitation symptoms will usually resolve themselves without treatment within a few weeks. The third, or latent stage of syphilis begins when secondary symptoms abate. At this point, there are generally no outward signs of syphilis, but the bacterium continues to thrive internally. If syphilis is not treated, complications of the disease can result in a 4th stage called tertiary or late syphilis. This can spread to other organs, resulting in neurological problems like a stroke, paralysis, deafness, or dementia. Cardiovascular difficulties like inflammation of the heart's major artery, the aorta, may also follow from untreated syphilis. Eventually, these conditions can lead to death. The good news is that penicillin has been found to be a safe, effective treatment for this disease. A muscular injection of penicillin, sometimes with booster shots, is all that is needed to kill the bacterium that leads to syphilis. Your doctor will follow up with blood tests to be sure that the medication is working. Pregnant women will be tested more frequently to ensure a return to health, as syphilis can cause death in newborns. Talk to your doctor about getting a blood test to check for this disease.
Been waiting on your girl since around 10:30. Feeling kinda funny since we did the dirty.
Every guy I sleep with says the same thing. Let me guess, you got a rash on your ding-a-ling.
And I got cold sweats and I got the chills. And I've gone through a case of Lambicil.
I told you we should have used protection, but you couldn't think straight with your erection.
Now let's go to the chorus section.
Hey, syphilis girl, tell me what the fuck. You left your mark all over my jaw.
Hey, syphilis boy, better review. Did you get it from me? Or did I get it from you?
Hold up, girl, don't be no cynic. Saw you last week coming out that clinic.
You've tapped every ass in this place, even that skank with the sores on her face.
I didn't hit that, me and her was just chillin'.
Then what's with that bottle of penicillin?
Nelly, don't get the wrong idea. I take the penicillin for my gonorrhea.
Hey, syphilis girl, I got your disease. I wanted your body, not your STD.
Hey, syphilis boy, now don't you blame me. That's the price you pay for promiscuity.
Hey, syphilis girl, that's one wicked strange. By this time next week, we will both be insane.
Hey, syphilis boy, I think you are wrong. I'm feeling it now as we finish the song.
I'm talking about venereal disease, or kids may call it SIF, the clap, and crotch rot.
Clap, chlamydia, gonorrhea.
That stuff. They call it that stuff. Or she got you. Flamethrower. That means chlamydia. She got chlamydia.
The clap, the drip, the pox, Mary Jane, the jack, crabs, AIDS.
Clap, chlamydia, gonorrhea, that stuff. They call it that stuff. Or she got you. Flamethrower. That means chlamydia, she got chlamydia. The clap, the drip, the pox, Mary Jane, the jack, crabs, AIDS. I'm talking about venereal disease, or kids may call it SIF, the clap, and crotch rot. Clap, chlamydia, gonorrhea, that stuff. They call it that stuff. Or she got you. Flamethrower. That means chlamydia, she got chlamydia. The clap, drip, Mary Jane,
Chlamydia, HPV, and gonorrhea. Everybody loves their STDs. They are what people get from unprotected sex. Everybody loves their STDs.
So you claim to be a trained killer who stops for no man or woman. You do have a very impressive CV, Mr. HIV. You're able to infect people anywhere in the world, regardless of their age, race, religion, or sexual orientation. I see that so far, over 30 million people have died because of you, and over 33 million people are currently HIV positive, with 6,800 new cases every day. Wow! And best of all, there seems to be no cure for you right now. No vaccine.
Yes, the only thing that can stop me is a condom, or if people don't have sex at all.
As if. No, they will never stop. I know them, they're very naughty. But seriously, you don't really kill, do you?
That's the beauty of what I do, sir. I attack the immune system until it's so weak that when the other infections come in, our human, finito. gone.
In other words, you just help someone else to do your dirty work, huh?
Let's just say I turn an average infection into a lethal killer.
And you do this by poisoning of the blood or...
No. First, I sneak into the human body. Then I infiltrate those idiot white blood cells.
Right?
After that, I take over them, one at a time, using each one as a hideout to create an army of HIV clones.
Fascinating.
Once the HIV clones are ready, they burst out of the white blood cell, destroying it forever. Then each one of us goes on to do the same thing, over and over, until we wipe out those idiot white blood cells!
I'm liking what I'm hearing, Mr. HIV. I think you and I are going to work very well together. We are looking for viruses to wipe out the human race. Mr. HIV, with your credentials, you're hired.
I'm talking about venereal disease, or kids may call it SIF, the clap, and crotch rot. Chlamydia, gonorrhea, that stuff. They call it that stuff. Or she got you. Flying blower. I mean, chlamydia, she got chlamydia. The clap, drip,
More rapid than eagles, and bits no larger than bites. Helping you protect yourself from Mr. Painful Blister since 1842, this is Quick Zips, the late night edition. Sexuality education, fast.
I'm Galena Mines, and welcome to our show. Inquiring minds want to know, and you folks inquire a lot. Many viewers have asked us questions about reducing risks. So today, we'll talk about how can I reduce my sexual health risks related to STIs. The short answer? Avoid any and all sexual activity. That is, be abstinent. Being abstinent is the only 100% way to avoid STIs in pregnancy. However, if a person is sexually active, then they should always use a new latex condom for any sexual contact and get tested regularly for STIs and other infections. That is, practice safer sex. The long answer? When it comes to sexual health and sexual health risks, it's not who you are that makes a difference, but what you do. In other words, reducing risk is all about your behaviors and the actions you take to reduce your risk. Imagine 3 people who are pretty much the same in terms of where they live, their grades, friends, activities, and social status. The first person is not, and has never been sexually active, doesn't use needle drugs, or any other drugs for that matter, and doesn't drink. The second person is in a sexual relationship with one partner, was tested for STIs, and always uses a latex condom for all sexual contact, never uses drugs or alcohol, has talked about sexual health with a partner and with a healthcare provider, and knows that the partner has too. The third person has multiple sexual partners and sometimes uses a condom for sexual intercourse, but not for any other types of sexual contact. Occasionally uses drugs and alcohol at parties, has never been tested for an STI, doesn't know whether partners have been tested, but feels fine. Clearly, these 3 friends have completely different sexual health. They're very similar, yet their behaviors make their sexual health very, very different. Let's look at why. Staying sexually healthy really involves 3 things. Completely avoiding STIs, reducing risk of infection, and being sure you don't have an infection. As you may know, STIs are primarily transmitted through the exchange of body fluids and direct skin-to-skin contact, and sexual activity is one of the main ways that happens. Person 1 understands that the surest way to stay healthy is to avoid risk altogether. You do that through abstinence from all risk behaviors. No sex, no drugs, no tattoos, and so on. That means no sexual contact of any kind. No penile vaginal sex, no oral sex, no anal sex, no manual manipulation, that is, touching other people's genitals. Hugging and kissing is usually okay. You can't usually get an STD from swapping saliva. However, if you are infected with herpes or syphilis and have sores on your mouth, you could pass the infection to your partner through kissing and through oral sex. If you choose to be sexually active like persons 2 and 3, then the best way to reduce your risk is to always correctly use a latex condom. Have only one partner. Get tested for STIs prior to having sex. Person 2 clearly gets it. Person 3 doesn't. So let's break it down a bit. If you are going to be sexually active, you need to use a condom for all sexual activity, every single time. Oral, anal, penile, vaginal, each time. Every time. No exceptions for forgetting. No exceptions for being buzzed or horny. When you get condoms, make sure the package says that they may be used to prevent STIs. The most common kind of condom, latex, definitely works. If you or your partner is allergic to latex, then polyurethane condoms are a good option. However, other types of condoms made from natural materials, sometimes called skins, are not as effective at stopping STIs, including HIV. You can get condoms in stores that have a pharmacy and a lot of other places as well. One partner means that you and your partner are only seeing each other and having sex with only each other and not anyone else. Having only one partner ensures that neither of you bring anything special, like an STI, into your relationship by having sex with someone else. Getting tested can help ensure that neither of you have brought something special into your relationship from a previous relationship. So, if you break up with somebody, getting tested before you get involved with someone else can make sure you get off on the right foot. Get the test. It's no big deal. You can go to your doc or to a clinic. It's private and generally painless. So, if you're sexually active, you should always use a latex condom. Stay with one partner and get tested, both you and your partner. Anything less than this can negatively affect your sexual health. By the way, some people say that condoms are not effective. This is misleading. Condoms are not as effective as abstinence, but when condoms are used consistently, that means every time you have sex. And when they are used correctly, that means checking the expiration date, putting them on and taking them off correctly. They are up to 95% effective in preventing STIs, including HIV. And they protect against pregnancy too, which is a nice bonus. And that's what we call safer sex. By the way, I call it safer sex instead of safe sex because the only 100% safe sex is no sex at all. Since many STIs are transmitted by body fluids, another way to reduce risk is to avoid sharing items that carry body fluids, such as intravenous drug needles, sex toys, and needles used for piercings or to make tattoos. And another thing, anything that makes it more likely that you will do something risky should be avoided. Alcohol and drugs, for example, can make you more likely to take risks you wouldn't normally take. That's it for this segment of Quick Zips, the late night edition. Remember, the surest way to reduce risk is to be abstinent. If you don't engage in any type of sexual activity, you likely won't get an STI. If you are sexually active, then the surest way to reduce risk is to practice safer sex, including the correct and consistent use of latex condoms in an infection-free, monogamous relationship. Be safe. See you next time.
This episode of Quick Zips is brought to you by The Blue Streak, who would like to remind you to use a latex condom. Use a latex condom. Every time, every time. And be sure to check out his new show, Top 10 Condom Errors, the follow-up to his smash hit, Top 10 Stupid Condom Errors.
HPV and gonorrhea, everybody loves their STDs. They are what people get from unprotected sex. Everybody loves their STDs.
I couldn't be sure what I had, if I had anything.
Well, after a week of scratching, I figured something's up.
Get tested. It's always in your head, but it's a different thing to actually walk through the door.
I never thought I'd be thinking about STDs or STIs or whatever, but I guess I was wrong.
We've all joked with mates about getting tested. I mean, I have enough gags and urban legends to go on a comedy tour with. But I think knowing what to expect, it really makes it a lot easier.
The important thing is to say to everybody, not just people who are thinking about it, but that everybody who is sexually active should be thinking of coming in for an STI test. That, you know, people, while they're sexually active, should probably consider having an STI test done about twice a year, because the vast majority of the time they won't necessarily have symptoms, which doesn't mean that they're not actually have something and passing it on, or that it might ultimately do them some harm. So the only way to know in most cases is to get tested. You're not going to just know you have something. You're not necessarily going to have any sign of it. And then the second thing, I suppose, would be to somebody who has made that decision to come in and have a test, that it's a very responsible decision and it's not going to be a big ordeal. It's actually, they're going to see a doctor, they're going to be seen for probably about 20 minutes altogether. Most of that is actually going to be chat, and then a small amount they're going to have a blood test and they're going to have a swab. And that's really it. You know, so it's not a big ordeal. Everybody should be doing it. Nobody looks on the person coming in with any kind of stigma. In fact, we would think that's a responsible individual coming in to just get checked out. The swab, now, because I know this is one of the things that there are misconceptions about, is that, you know, the length of time this takes, the amount of how far it gets put in and how painful it is. And I'm not going to say that it's not a little bit uncomfortable, but really it's only for 30 seconds and it's a really, really narrow, slim swab. And only this part of it has to get put in, the little white bit around the top. And for the vast majority of men who would be coming, that would be it. That would be the only contact that they're going to have. You cannot, by any kind of visual means, identify who does or doesn't have a sexually transmitted infection. So you have to just say, A, safe sex, you're going to use condoms all the time. B, you're going to get tested about twice a year while you're sexually active. It's the only way to actually really look after yourself. And I suppose the last thing really, the big thing is, it's not a cause for panic. I mean, you're treated quicker than you would be for a sore throat. If you have chlamydia, you take 4 tablets in one day and that's it, you're done. So you're not going to be subjected to any terrible ordeal, and you're not going to have something for life. You can actually do something about it very, very easily and be fine, be fixed, be free to move on again. You know, so I think that's the important thing. It's very easy to manage most of them.
End of the day, these things are always much worse in your head, but it really was quick and painless.
So it was just 2 tablets. That was it.
But it turns out I was okay in the end.
Chlamydia, HPV, and gonorrhea. Everybody loves their STDs. They are what people get from unprotected sex. Everybody loves their STDs.